If you suffer anxiety, you have probably heard of cognitive behavioural therapy. It's the most commonly used and successful therapy to treat anxiety disorders. But maybe you're a bit reluctant to have therapy because you're not really sure what it involves. So in this video, I'm going to take you through what typically happens in a course of CBT. In the first session, the therapist will likely conduct an assessment to understand the nature and extent of your anxiety. This will include discussing your symptoms, triggers, and how anxiety affects your daily life. You may also talk a little bit about your past, though CBT focuses mainly on the present. Also in the first session, you are likely to set goals and talk about how you will monitor your progress. In the early sessions, you will do a lot of psychoeducation. This means teaching you about anxiety, how it develops, what maintains it, and the symptoms it can cause. You most definitely will learn about something called the anxiety cycle, and the therapist will explain how CBT is used to interrupt the anxiety cycle and lower your anxiety. As the sessions progress, you will learn about cognitive distortions, also called thinking errors. You will learn the different types and learn to identify your own thinking errors. Homework is very common in CBT, and you will likely be given thought records to record your thoughts. And with the help of the therapist, you will learn to challenge and restructure your thoughts into more balanced ones. You will learn to identify behaviours that are fueling your anxiety and work on reducing them. Depending on the type of anxiety, you may also do exposure therapy. This involves gradually and systematically confronting feared situations in a controlled way to reduce avoidance and anxiety over time. Further into the sessions, you are likely to do some behavioural experiments. These involve testing out beliefs and predictions about anxiety-provoking situations to see if they hold true in reality. You are also likely to learn some healthy coping mechanisms, and this might include relaxation techniques like deep breathing, progressive muscle relaxation, or mindfulness in order to manage the physical symptoms of anxiety. Throughout therapy, you are likely to hold regular reviews to review progress towards your goals and make any necessary adjustments to the therapy plan. You will also learn how to prevent relapses, but also how to deal with setbacks if they do happen. In the final sessions, you will review the progress you've made and start discussing when therapy will end, and start preparing you to be able to manage your anxiety on your own. If all has gone well, you will reach a point where both you and the therapist agree that you are ready to end therapy. But this doesn't mean that this is the end of CBT. CBT is something you can use for the rest of your life. And if you are struggling again in the future, it is often possible to go back to your therapist or to another one to get you back on track. If you are still a bit reluctant and want to get a more detailed look at CBT, I have a number of videos for different anxiety disorders that covers everything you will do in CBT, including how to use tools like the thought records and behavioural experiments. Here is a link to my video for generalised anxiety disorder, and here is a link to my video on panic disorder. I don't think there's anything else on YouTube that goes so in depth into these anxiety disorders, so set aside some time to watch them. Take care now.